This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. I'm Dr. Alice Jeroman, a board-certified veterinary allergist and dermatologist, and...
I'm not. I'm her sister, Janet Novotny King. It's good to see you all or hear you all. Hope you're listening.
Hey, Janet, I wanted to talk to you today a little bit about supplements for pets because I literally 2 nights ago...
Could you define a supplement?
Yeah.
Like to me, it means the joint pill I give Libby every day.
Oh, okay. Okay, yes, good, thank you. Let's start at the top. Supplements are non-food items that allegedly enhance your health, okay? They're anything from glucosamine chondroitin to holistic things like dandelion root, but a couple of key things. They're not FDA regulated, so you're not really sure of what you're getting in each product, especially if you're not dealing with a reliable company, which we will address. And secondly, they're not allowed to make any health claims. They're not allowed to say glucosamine chondroitin helps or cures arthritis. They're allowed to make real general things like it may improve your lifestyle. Okay, so that's a supplement. Anyway, about 2 days ago, I was reading... I was listening to a webinar by Dr. Asirno about this new supplement for cats with kidney failure. Because when you're in kidney failure, your kidneys aren't working and your toxins are just circulating through your whole body. And, you get lethargic. Sometimes you get kind of out of your mind. Like animals will just pace and act abnormally. So they came up with this supplement at Midwestern University, I believe, and it's called Porus One, Porusone. And I love it because it has science behind it. It was developed at a university by, a veterinary researcher. What it does is it's an absorbent, and you give it to them in their food. It's a powder, doesn't have any taste, he said. And what it does is it acts to capture some of those toxins that are circulating in the blood, and you poop them out.
So it soaks it up.
So I couldn't...
Like a tampon.
I'm sorry?
It soaks it up like a tampon.
Well, whatever. But anyway, I was so excited about it because, she's 21 years old and I have her on all the kidney stuff, the kidney diet. She's getting fatty acid supplements, which we'll talk about as another supplement
for our
in a minute.
listeners,
Fish oil.
Refresher.
Yeah.
She's a real crank
I
puss.
know. That's Capri. We love her to death. I call her Baby Capri. So anyway, the other story that goes along with that, okay, so I called the wholesaler that I deal with in Ohio, but they could only send the product to Ohio. They don't want to be sending drugs all over the country, just taking my word for it. So anyhow, I called I Googled Porus One, where can I get it? Quickly. So I Googled one of the online pharmacies that you can buy veterinary meds from. I called them at 9:05 a.m. I was on the phone to 9:40 a.m. I had to jump in the shower so I could go to exercise class. I had to give the phone to my husband and say, would you just please, for the 4th time, give her my Visa number?
Gosh.
Because she kept 7304, 7340, whatever. So, but anyway, I'm supposed to get it in 1 to 3 business days.
Years.
So it's called Porus One, Porus One, and I'm excited about it because in the past, what we've done for kidney failure in cats is we tried to get... the laxative Amphogel?
No, gladly I don't know about that.
Try to put that in their mouth. Well, it's like Maalox, but it's aluminum hydroxide. Try to put a teaspoon of that in a cat's mouth. Picture explosion all over the walls, okay? This is what happens. So Anyway, that I wanted to let everybody know about that supplement because it sounds really good to me and there's science behind it. And science behind it is the name of the game.
So I have a question. So, there's baby aspirin, there's pediatric vitamins, but dogs are kind of the same as humans. You have them as puppies, and then they grow up to be, or kittens, dogs, cats, then they grow up.
Right.
But when you go to get an animal supplement, do they break it down by, like, I know pediatric's probably not the right word, but puppy and adult supplements?
Right. And really, getting back to puppies and rescues like we both have, they were usually not on a great puppy diet.
Right.
They didn't have a good start to life. So I preface that because I wanted to say that normally puppies that you get, say from a reputable breeder or what have you, are given a growth formula food. But when we get these rescues, listen, they're fed the cheapest stuff possible. Okay, they take a bag of food, throw it on the floor, and let 20 puppies come and eat it. So that puppy would need a supplement. So because they haven't had good nutrition.
Say I'm going to give my dog a supplement.
But why? Why would you if you have it on a good brand name
so it's
dog
not
food?
Absolutely necessary. Okay, getting back to supplements. So what do you advise like pet owners to do? I mean, I give our Libby, our Golden, the joint thing because she had the hip accident, right?
Yes. Okay. So, there's a couple things. We know that fish oil is an anti-inflammatory. Okay. But there's a million brands of fish oil out there.
And dosages.
And dosages, yes, we'll talk about that. How do you know what you're getting is really in that capsule or in that liquid? So there's a couple of brands. I can think of one veterinary product called Nordic Naturals that they do testing on their product to make sure what's on their label is in their product. So that's one good thing. Consumerlab.com, and I've talked to you about this before, $65 a year if you join, is an independent lab that actually rates supplements for humans and for pets.
They rate everything. They do olive oil.
They do olive oil. They
It's
do
amazing.
Vitamins. They do probiotics. So it's well worth. I've given that to friends of mine as a Christmas gift because I think it's just a wealth of knowledge. Another one that they rank or did rank, I haven't checked it recently, high for people was Kirkland brand, which is Costco. And who would think that Costco brand is way up there quality-wise, for fish oil capsules for you and me. But anyway, we know that it can help as an anti-inflammatory. So arthritis, some veterinary cardiologists recommend it as an anti-inflammatory for heart disease. Certainly as a dermatologist, we recommend it. I personally think that a diet high in fatty acids, like a fish-based diet, gets that pet more omega-3, omega-6 fatty acids than a capsule. And this is anecdotal, but I would notice that my patients that I put on a fish-based diet, which I used to love, IAMS Response Formula Fish and Potato, and they don't make it anymore. But say one of the Hill's salmon diet, okay? I noticed that those patients did a lot better than the ones that I had giving fish oil capsules to. And I come to find out there's so much more omega-3, omega-6 in a serving of that food than what you could have given in capsules.
Who knew?
But if you did decide, like with Libby, if you did decide she's on glucosamine chondroitin, a joint supplement because she needed that because she had that horrible, after she was hit by the car and left for dead in the field, and then you guys had the surgery on her. If you decide to give fish oil too as an anti-inflammatory, you've got to start low because this is oil going through you. Okay, it can cause burping, it can cause soft stool, God forbid diarrhea. So thank you for mentioning that because that was not on my list of 3 supplements to talk about today.
What other supplements?
But I did want to mention, being an allergist, there are 2 supplements that do have science behind them if you have an itchy allergic dog. One is called Redonyl, which is Redonyl, which is a big, long name of a medication that's actually used in humans. Well, it's not a medication, it's a supplement that can reduce inflammation. And the other one is kiwi-based. Kiwi actually has some anti-inflammatory properties. It's called Dermaquin. But see, you don't need those for your dog because your dogs are not
No,
allergic.
she's not.
My little Annie, I think, is growing into allergies, so I'm going to be sending for that. But I'm not going to call that online pharmacy and be on
Right, because
another half
online
hour.
pharmacy, not good.
I know.
But I will say that Libby does supplement her own with goose poop, duck poop, and deer poop.
Yeah.
How do you stop her?
We need to talk about eating poop, because that little Amish one of mine, Annie, eats
That's
her
a
poop.
common thing.
I have to be out there real quick. But I think that's because she had a litter of puppies, and they're
Yep.
in this barn, in this cage, and she wanted a clean
And also,
nest.
she may not have been getting enough food.
Yeah. Yeah. You know, the China Rescue Gidget, she has blossomed because she's like put on muscle and everything else. I don't even want to know what she
No,
was
we're not
eating
going
over
to.
there,
No,
if
we're not going
anything.
to talk about it. We're not
No,
gonna
no,
talk
no.
about it.
We're not
All right.
going
Any
there.
other supplement talk
No.
for you? What else? What other tips?
Last one that I want to talk about is coconut oil. A lot of people ask about coconut oil. Coconut oil doesn't have a lot of anti-inflammatory properties to it, and it can cause pancreatitis, high fat. But it does have something called MCT, medium chain triglycerides. As we get older, or dogs with neurologic issues or even epilepsy, if you supplement with MCT oil, they actually will get improvement. And Purina came out with a neurological,
Yep.
Brain diet that has higher levels of MCT oil in it. So, you guys out there with dogs that have neurologic problems, especially epilepsy, I would ask my vet about the Purina prescription neurologic diet. And, you can I bought MCT, there I am, I bought it online. I probably should have gone to a health store or something. But I bought some online for my former dog, because she was 14 and a half and she was an Irish setter.
Yeah.
So we should start taking that.
Okay.
Because it actually feeds your brain,
text me,
they said.
because my brain could use that.
I will.
Because I can't pronounce all those medical terms.
But the big question I was getting before I retired is, what about CBD?
Oh.
What dose does CBD help allergy? What does CBD help? We are so lucky today because we are going to have whom I feel is the nation's CBD expert, Dr. Jeff Powers, who actually did all the legwork research when he was head of that AVMA, American Veterinary Medical Association committee that was responsible for making their policy on CBD. So we're going to be talking to him this afternoon, and I can't wait because he is just a wealth of knowledge.
Where's he from?
Michigan.
Oh, bad word for me. Bad
And
word.
even though we
word.
love him, no, he's still part Buckeye. Wait a minute.
I'm warming
because
up. I'm
when
warming
we
up,
met
Tim.
I will. Okay, get ready. When we met on this AVMA committee that we were on for 3 years, we were talking, and I told him that I was going to. Oh, there's the Buckeye. Thank you. That I told him that we were going to see the Temptations in Youngstown, Ohio, at Powers Auditorium. Guess whose family founded Powers Auditorium?
Dr. Powers.
So see, we do love him. He's got an Ohio connection.
We'll take him.
I'm telling you, I'm so proud of him because he got so upset with the CBD products out there that he actually started manufacturing his own, and he'll tell us everything that goes into that and how you have to have the final analysis of the product to prove what's in there and how much. I'm so proud of him. I don't know how he has time to do all this.
Well, because he's passionate about it.
And I have to tell you, he owns Powers Hardware
What's that? Is that in
in Michigan. It's a
Oh.
hardware store. He runs Powers Hardware. He takes care of the horses in the summer in Mackinac Island so that the vet there could take some time off. And he makes and produces his own CBD and runs 2 vet clinics. I'm tired just thinking about it.
And his CBD products are veterinary only, correct?
Well, when Mike's shoulder was bothering him, he sent us some.
Oh, and that's why Mike kind of wags
I don't
his
know.
tail.
Good. You know
That's
what?
why Mike wags his tail now.
Yeah, you know what? Ask him about that.
Okay.
Ask him about that.
Okay. All right, so
Okay.
we got to wrap it up,
So,
sister.
yeah, let's take a break and let's get Dr. Powers on. Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. contact your veterinarian about these prescription Blue Buffalo diets. Hey, so we're so lucky to have Dr. Jeff Powers here to answer our veterinary questions about CBD, because we have so many questions, not only about what it can be used for, the dose of it, how to tell what a good product is. Janet, why don't you start?
Well, like, how is CBD different from marijuana?
Um, well, that's a very good question, and I think it's one that people don't understand real well. So the key is to understanding which plants are used to produce these different products. The marijuana plant is, by definition, has higher levels of THC, tetrahydrocannabinol, which is the component that creates the high or
Mhm.
the euphoria.
Mm-hmm.
And CBD is also present in very low levels in marijuana plants, but in hemp plants, the situation is reversed. And the plant, although it looks almost identical, produces very high levels of CBD or cannabidiol, which is a cannabinoid similar to THC. However, it does not produce the euphoria and has effects on the body in many different other ways. So those are the main differences. Hemp plants, by definition, have less than 0.3% THC in them. And whereas a marijuana plant can have anywhere from 10 to 15 to even
Wow.
today up to 30% THC in the flower component of the plant.
Wow, that's kind of scary, because,
is
you know,
scary.
if I would think if dogs get a hold of that marijuana, well, I know you see some toxicities like weekly in your clinic, right, Jeff?
Yeah, absolutely. I mean, the one thing that is a little bit confusing is in very low amounts, THC is actually can be helpful to pets as well. However, dogs in particular have more receptors for the cannabinoids in their brains, so they can get high or in like a stupor at a very low level of THC. So yeah, one thing that can happen is dogs will accidentally ingest THC. It might be lying around the house, especially edibles today are very popular. And so the dog can ingest it and get very ill. Usually not to the point of fear of death, because the cannabinoid receptors in the brainstem that controls respiration are thankfully very low, but they can get very, very ill. They can pass out. They can, their hearts, especially a dog with a heart condition, could get very depressed and could have serious consequences.
Pet owners should be really careful about the human
God,
edibles,
yeah.
right? Around their pets.
Yes,
They're probably not thinking about that.
no, absolutely. And people will sometimes be confused about what CBD is versus THC or marijuana products, and accidentally like, oh, they're fine for me, I'll give one to the dog. But the dog is more sensitive, and cats are more sensitive to THC than people are.
So if someone thinks they want to try CBD for their dog, what diseases or what maladies have been proven that it can help for? Like, what has some science behind it for what diseases?
So the main areas that CBD has scientifically been shown to be beneficial for is reducing pain and increasing movement in dogs with osteoarthritis. Much like in people, CBD has been shown in studies to reduce frequency of seizures in dogs. There's increasing work now in the area of anxiety, and the results have kind of been mixed, but what they have found, recent study, as long as you get a significant amount of CBD into the pet, it can also be beneficial in reducing anxiety as well.
Like at the vet's office or for car rides and things?
Yeah, there was just a recent study about that in exact. So like take, for example, osteoarthritis. They found that the studies show that about a milligram per pound
Mhm.
twice a day has been helpful in dogs. And in anxiety, they find that it sometimes takes up to 2 to 4 times that amount
Hmm.
to produce the desired anxious results consistently.
Does
The,
it
oth-
work right away, or
the,
is
oth-
there a lag
that,
time?
the other people, a lot of times, will think, oh my God, there's a lightning storm and there's fireworks. I'll give my dog CBD, and it doesn't work because
Mhm.
it takes uh, about 2 hours from oral ingestion
Oh,
of
okay.
the CBD product for it to actually reach its peak blood level. So
Huh.
it is beneficial, but it just takes a while for effect.
Are vets on board with this? Like if I go to my vet and say, Libby's really nervous or something, would a vet prescribe it, or does the pet owner go out and figure this out?
Well, this is a common question and problem because a lot of states simply have not addressed this issue very clearly. There's
Mhm.
only a few states in which veterinarians can legally talk about giving CBD to
Oh,
Right.
pets. And so a lot of times, although knowledge is increasing across the country and more vets are becoming more familiar with this,
Mhm.
the legality from in use in human medicine on down is still somewhat behind where it needs to be. And so some vets may be up to speed on where it can be used and when it can be used, and a lot of other ones may not be, or may be fearful to even recommend it because of potential legal implications, because
wow.
it's not a pharmaceutically approved medicine at
Mhm.
this point, except for there's one approved drug in human medicine,
Oh, that's
um,
right.
Epidiolex, and that is for seizures in children. That's a
Mhm.
purified form of cannabidiol or CBD. So technically, a
Mhm.
veterinarian could prescribe that FDA approved form. However, the cost is it would cost like $1,000 to
Yeah.
treat a dog for a
Wow.
short period of time because of the cost.
Wow.
I forgot about that because we haven't talked in a while about CBD, but I forgot that veterinarians were even banned from answering questions from clients about that. Can you believe it? I mean, and yet the owner can go to the store and just pick up any crap that's labeled CBD off the shelf, and buyer beware. So that's why I wanted to ask Jeff, if I do want to put my dog on CBD for epilepsy, what do I look for in a product?
So what you look for, that's a really good question, Alice. So one thing is by law, if products are now advertised online on most any reputable sites, there needs to be a link on the website to third-party testing of the product,
Huh.
so you can see what's actually in the product.
Huh.
That is improving. However,
Mhm.
studies have also shown that there's a lot of inconsistency now in uh, up to like a third or two-thirds of products will have varying levels of THC or CBD in them by
Oh.
a factor of 10% from what's on the label. So it's an area that's improving. However, a lot of times you have no idea unless you do the research to see if the products are in fact having what they claim to have it.
Will the label have the dose for that dog or cat? Or they're just going by a dose they looked up on Dr. Google?
So that is another problem, is a lot of times the doses that are listed on most of the products, even the ones that are often sold in veterinary clinics, are
Mm-hmm.
probably below these research proven levels. So
Oh, I
they're
see.
often at a lower level, which in one part is okay because dogs do tend to absorb CBD quite differently. There's been research that
Hmm.
shows that uh, some will absorb it very well, some will barely absorb it. And so that effect probably indicates why in some times it works really well at low doses. And take, for
Mm-hmm.
example, osteoarthritis. Like I
Mm-hmm.
said, the dose was about a milligram per pound. Well, there's been studies it in some cases it's worked as low as a quarter milligram per pound, and it's shown benefit. And
Huh.
there's been other studies that showed it had to get much higher levels, and
Before
probably
benefit.
some of the variants is related to how it's absorbed.
So that could be tricky though, if you have a small dog or a big dog, right?
Yeah.
Yeah, absolutely.
Is there breed differentiation? Like, do poodles absorb it better than Labrador retrievers, or that wasn't noticed?
There is some there, and I don't remember that offhand exactly which breeds, but there can be some variants according to breed as well, although it's a minor factor.
What are
So-
you seeing as far as adverse effects? Are you seeing any?
So the biggest adverse effect that we see, I mean, I have a lot of people. We actually have a brand of CBD that we grow, research, test
Mm-hmm.
repeatedly, and then we also have some of the other brands that I have experience with. About the only problem we see occasionally in dogs is sedation. Some dogs will get really sleepy at even a average dose.
Mm-hmm.
And once in a while, if dogs are given a lot of the CBD in a tincture or oil form, they may get a little diarrhea.
Okay.
Now,
Huh.
there has been more reported adverse effects, although like the World Health Organization came out and said that cannabidiol, if it's in fact in the product at the right dose, cannabidiol is considered safe by the World Health Organization.
I just read last night, Jeff. I was going to text you. Hills and Colorado State just published some results. They did, I want to say, a 32-week trial of 5 milligram per kilogram per day and 10 milligram per kilogram per day, which is high. And they saw no adverse effects. They saw mild liver enzyme elevation that didn't affect the dogs clinically.
You know, that's good information. And
Yeah.
5 gram per kilogram per day, that's about, if you divide that by 2, that's like with your kilograms and pounds out there, that comes real close to that 1 milligram per pound
Per
dose.
pound, right.
When I'm talking to pet owners, I go to the per pound dose because it's
Oh, you have to. Yeah.
rather than having to try to convert it all the time.
Right. One more chance of error by having them convert.
Pet owners prefer that.
Yeah.
In certain states, you're not allowed to talk about, CBD or THC as a veterinary doctor. So if a client asks you, what do you do? Say, I'm not allowed. Like, how do you handle that?
Well, I mean, what I do, technically in Michigan, we have a law that we can discuss it with them. We can't technically prescribe it, but a lot of times what I'll do is I'll try to point to research. There's nothing illegal about me showing a client research information and passing along good knowledge. And I think that's probably something that veterinarians really, whether your state has it legal or not, I think that it's imperative to understand where the research is and what the current state of it is, because like, Alice, clients are using it anyway. People are,
I know.
and they've been using it for years.
Yeah.
And so, and the fear is, especially with more and more, like in Michigan, we have these dispensaries everywhere.
Oh, we do too in Ohio.
We do
Yeah.
too.
And people are picking up products. They're picking up products for themselves.
Yeah.
And might be getting an animal product. They might see gummies, and they can, they can mistake it. We have them all the time. We had one a couple weeks ago that they think they gave their dog their gummies accidentally. And, we'll see these dogs coming in and they're a little, I mean, they sort of look like a person that's too high. They're stumbling around. They might be
Funny.
dribbling urine is a real common.
Yes. I remember you told me that. Yeah. Yeah.
And then you start discussing, we've had some cases where people found out there was marijuana in their house they didn't know was there.
Oh, because it's always the roommate.
Yeah.
Yeah. Yeah. I was telling Janet that you got so disgusted with the quality of the products that were out there that's when you decided you were going to make your own and have it analyzed and have great research behind it. What's the name of yours?
Oh, just Beaver Island Hemp.
Okay, Beaver Island.
Yeah.
So
Got
how
it.
did you go about having a product like that manufactured?
So,
He owns a hardware store. He knows stuff,
I know
Janet.
that.
well, actually, when I was on AVMA, one of the reasons I started was, I mean, I started taking CBD myself, actually,
Mhm.
because I used to do a lot of large animal corn rotator cuffs. So it's like
Oh,
some nights I'd have to wake up and take ibuprofen to get to sleep, and looking for like a natural alternative. And so I actually researched and found some good brands and started taking it, and found that the biggest thing is it kind of helps you forget your pain. And it must do the same for animals. And there's a
Interesting.
reason for that, because it actually blocks. I have a cat right here walking by.
Oh, yeah.
But it actually blocks the nerves from communicating. It works at what's called the postsynaptic junction. So the nerve, like it may fire, but then
Mhm.
before that signal gets to your brain, the endocannabinoid system and these cannabinoids actually block that pain.
wow.
Hmm.
And it's part of your body's natural system, because say you cut your hand real bad, you may
Mhm.
feel like that initial pain surge, but then it, even as you're dealing with it, it kind of goes away, and that's actually your body's own cannabinoid system kind of
Huh.
releasing a whole bunch of natural chemicals to reduce the pain so you could tolerate it and get it under control. It helps keep your body in balance. Anyway, so I was like trying CBD, and wanted to learn more about it. So I decided I would actually try to grow and make some. And so what I did is I started growing some plants in a very natural, organic environment. And I started using methods to isolate the cannabinoids, extract them. And I made some myself, I probably look like the mad scientist. That's what my wife would
Like chemistry lab.
No, Breaking Bad. Breaking Bad.
Yeah.
Yeah, exactly. I did really well in like chemistry in college. And so I started
I'm
making it.
so glad someone did.
Yeah. And actually I found that the stuff I made, maybe it was because it was fresher, I don't know. It seemed to be as good or better than what I could buy. And so I started
Oh,
giving it to some friends, family members, making it for people, and found that everybody kept saying, you need to make more of this. You're onto something here.
It's like my
So
spice cookies at Christmas time.
yeah, right.
absolutely. So from there, I decided, well, I better do it, the legal right way.
Yeah.
with,
Yeah.
Create a business. Michigan was starting a hemp program at the time. And so we grew the plants, and then I found a couple licensed processors who I could take plants to.
Wow.
Once I've taken the flowers off, take the plants there and have it extracted. And I currently work with a licensed extractor processor in Michigan, and there's a number of ways you can do it. You can use alcohol extraction, you can use CO2 extraction, you hydrocarbon. But the problem with hydrocarbon extraction, it gets everything out of the plant, but also leaves some hydrocarbon potential
Oh.
products. So we work with this processor who has subcritical, very low temperature CO2 processing. So it's really clean at getting out the cannabinoids. And so from there, we get our extract tested first to see how much is in it, make sure there's no heavy metals in there, make sure
Yeah. Oh, good thinking. Yeah.
mycotoxins, fungus,
Right.
any pesticide, anything like that in there.
Wow.
And from that, we take and make it into tinctures or gummies or treats for dogs. And then there's another whole level of testing there. So we measure it out, actually test again to make sure that, again, in our processing, everything is kosher as far as levels are accurate to what we have on the label. and there's no dangerous or harmful products in there.
If our listeners wanted to get the product, then would they have to reach out to Dr. Powers?
Yeah, we have a website,
Oh,
beaverislandhemp.com,
oh,
or
good.
definitely reach out to me as well.
Okay.
And we have most of our products, our sales are for pets, although we have a lot of human customers are using it topically for pain
Mm-hmm.
and orally we have daytime and nighttime gummies. In our nighttime gummies, we put in a little bit of CBN. That's another cannabinoid that is in low levels in either hemp or marijuana products, but it increases sedation or calming a little more than CBD does alone by itself. So you put that in some of our calming treats as well for dogs. And there's a number of companies now that are also doing that. They're adding in a little CBN, and anywhere you buy nighttime gummies, you can go buy Martha Stewart's nighttime gummies, and their formula is very similar to ours as far as having CBD predominantly and a little CBN in there.
That's because they're Snoop Dogg approved. If I'm a pet owner and I think my dog has ingested, do I go right to the vet or do I induce vomiting? Like what should I do as a pet owner?
If you think he's ingested like marijuana products,
Yes.
well, I guess I would say talk to your vet. That would probably be the thing to do. I mean, first of all, try to figure out how, and if you go do that, try to have any information on how much they've ingested, and it may be a safe level and may not be. If your dog's not showing any symptoms and maybe only ate one small gummy, it might be okay. However, if it's, showing signs of wobbling or anything like that. I mean, I have heard cases of dogs actually having seizures from ingesting like vape cart, chewing on
Oh my God.
Oh, I'm sure there's so much nicotine in there.
in the oil and
Yeah.
in the THC vape cartridge. The oil is real concentrated, so that can definitely cause issues.
Wow.
I didn't realize when you said you guys tested your products for heavy metals, for fungus, molds, and pesticides. Do other companies do that? And if they do, how would I know that?
You should see that on their website, and most reputable do that.
Okay.
But and because that's been some of these studies they found, especially in studies done in Europe. That's why I'd be real skeptical anything like you get at the gas station or anywhere, because a lot of the CBD products are still coming in from China or overseas.
Oh, brother.
And in fact,
One
there's
more
a
thing.
lot of concern about like these synthetic cannabinoids or synthetic CBD out there, that or like THC8, or there's these other cannabinoids out there that can be toxic to dogs as well, and really want to stay away from anything like that.
Do you have many cats on it? I'm just curious because cats are hard to give anything to.
Cats are hard to give it. I have a few cats that that do take it and like the treat, and it seems to help for arthritis. But most of them, you can't get them to eat it.
Yeah, I believe it. Also in my department, allergy and dermatology, I know they did a study. I'm not sure, was it Epicure that did the study? I can't remember the company that did the study using it for allergy.
Yeah.
And it did help with itching. It didn't help with skin infection, but it helped with the itching.
Yeah, I was going to say that was Elevet did it, and there was
Elevet. That's right.
And actually, I've been using it a little more recently, and I've had a number of people have told me that it's kind of, because a lot of times with intense itching dogs, there's like an anxiety.
Yeah.
Yes. Oh, yeah.
That's associated with it. And in fact, I had somebody just 3 days ago told me, because I gave them some CBD about a month ago, and they said, they think that's really helping. It kind of helps calm the dog down.
Especially at night, because they're up licking and slurping and itching at 2 a.m.,
And it has been proven in research that dogs and cats with allergic dermatitis have more CB1 and CB2, which are the cannabinoid receptors. They have more of those receptors proliferating in the areas where the skin is inflamed. So
Is that right?
I cure the secondary infections and things like that, but it definitely has been shown that. I did have another client about 6 months ago. She said she came in and she just wanted to buy a bunch of CBD chews, and I said, "Are you using those? What are you using?" Because I'll always ask
Yeah.
people, and she goes, "Oh yeah." She said, all that stuff you told me to do for the dog, it wasn't working. So I came in here one day and I just bought a bunch of these CBD chews, and I wanted to tell you, I got the dog off most medicine, and this is all I give it, and skin's doing
I
great.
hope that's not a patient you asked me about.
No, it wasn't. It wasn't.
Okay. Do you have people coming in buying the veterinary stuff? I mean, for themselves.
Oh,
For
yeah.
humans.
Well, we keep our youth products right in there too.
That's right. So they can buy the human. Okay.
Hey,
Sorry, Janet. Go ahead.
But yeah, we get that question a lot, though. I actually have a client today that is wanted to try CBD for seizures in their dog. Their dog is increased in seizures, and they lived like 35 miles away. And she said, "Well, can I just go get CBD at the local dispensary?" And
Oh, geez.
I said, "Well, I suppose you could." I said, "You have to make sure there's no like artificial sweeteners in there, or things
Yes.
because that could cause a glucose issue.
Right.
Yeah. Right.
You have to really make sure that the amount is in there. And anyway, they ended up coming in, but actually,
Yeah.
we have a lot of customers that are using our CBD topicals for pain. I have one customer that he just swears it's the best thing for his knee pain.
Oh, wonderful.
It does penetrate about an inch to your, and I mean, I have I use it for my hands. Some days I get up now and the worst is the arthritis.
What's the base of that? Is it in oil or petrolatum, or what is it?
We have it in like a clear vanishing.
Oh, good.
Point.
Yeah. Okay.
And
So
also and sports sticks, but I tell them to do the oil or the oral as well as the topical, because the topical does work locally, but then the oil works systemically to reduce the pain.
Yeah. Yeah, because
Okay.
you're not going to put it on all of your hands all the time.
No.
I mean, you got to have some systemic effect. Right.
The
Right.
nice
Right.
thing is the absorption, and it lasts, even topically, it'll last like half the day. So,
Oh.
Wow.
Oh.
but it takes a
Cool.
little while to work. It
Yeah.
gets absorbed locally pretty quickly, but it'll stick around for enough time so you don't have to like feel like you got to keep putting it on every
Yeah.
time.
Right. Right.
Wow, that's longer than icy hot.
Yeah. That's
So,
right.
Dr. Powers,
And it
what's your-
doesn't smell like icy
I
hot.
love the smell of icy hot and Vicks. So, Dr. Powers, what's your pet peeve about pet owners?
Pet
Oh.
peeve.
Now, see, I didn't tell you we were going to ask you that.
What's your pet peeve?
Well, I do get frustrated times when I don't think they care as much
Yeah.
about the animals as I think they should. I mean, most of my clients, I think I'm kind of old and crotchety now, so I think most of the ones,
Like Alice is.
Yeah, if you can remember everything that you learned over the years, then it's
Yeah.
I don't know. I guess that's it.
Yeah.
Maybe. But I have a lot of people. I don't care whether a person's rich or poor. I see a lot of the people that barely can afford
Yep.
anything, and they'll do everything possible for their
Yep.
pet.
Yep.
And so, I do try to work within people's means. I think that's one of the biggest problems addressing our profession right now is where medicine gets more and more complicated. There's more and more options and
Yep.
things out there that we can do. However, it's a lot of times it's unaffordable to a lot of people. So,
Yeah.
And
I mean-
and Jeff and I kind of are in the same situation. We were in practices by ourselves. We weren't corporate. We refused to be corporate, and we just want to give personal attention.
Right.
And we were busier than all get out. And I never had to advertise. Jeff never advertised. Word of mouth, because it's so sad that veterinary medicine is trying to mirror human medicine by going corporate. I just see so much wrong with that. And I so admire Jeff for staying the way he is. You know, I'm sure he's being torn apart by calls and requests all the time. This is the individual attention that
Yeah.
people want for their family members. And these pets are family members. And yet, when I hear that, you know, to have a dental done at a big corporate office is $3,000, I'm embarrassed about that.
Yeah.
I mean, that's not how it should be.
No, and then they'll do it. They might do it one time, and then they'll never do it again because
Can't afford it.
they
Right.
can't afford it. I mean,
I
I'll give a shout out to you today. I had an allergy dog in about an hour and a half ago, and anyway, the dog. It's one of those dogs that reacts to everything, and
Oh.
but Cytopoint has really been helpful. Besides Bass has really helped you.
Yeah.
This in particular. And she came in and she said, and that's one I talked to you about like 6 or 8 months ago. And
Okay.
so she said, and communication, because she said, well, you know, we've been getting by, but I think we need another one of those cortisone shots. She said that really worked. So I pulled up the record and I'm like, no. It was Cytopoint.
Yeah.
And so I went back in there and I said, I think that the medicine that really worked was Cytopoint.
Mhm.
And she goes, that's it. She goes, you know why I come here? Because you get to the bottom of this stuff.
Well, but that would be me saying the wrong word, and then the dog would get the wrong drug. So
Well, and look what could have happened there. Had she gone to a different vet and said, yeah, Dr. Powers gave my dog a cortisone shot and it worked, and
they would
the
have
other
given him
vet
a
wouldn't have those
cortisone.
records. He would have given him a
Yep.
cortisone shot, which I know. You know, the other day I was listening to a webinar while I was walking on the beach. Sorry. But anyway, it was another dermatologist talking about how much it was to skin test the dog, and it was $1,300. Do you know no one ever left my office with a bill higher than $500, and that contained a year of allergy shots? Okay.
Yeah.
I couldn't believe it. I started talking out loud and people that were coming toward me thought I was nuts. I couldn't believe it. Who can afford to treat the pet? Our practice philosophy was we never want the pet to not get treated because of the cost. And if they wanted to pay me little by little, and you know, I had this elderly couple sending me $30 a month for 2 years after I retired. And, you know, they would take in stray cats. You know, Jeff, the type of person I'm talking about. You know, they had fallen, broken hips, all this and that. I sent her a note for Christmas. I said, Merry Christmas. Your bill is being voided for the rest of I mean, how nice though.
Yeah.
You know, they didn't have a you know what to piss in.
Yeah.
And they were still paying because they were so grateful of the care. And, you know, a lot of times I wouldn't charge them if I had extra samples and stuff. I mean, you know, people love their pets and they want the best for them. And I'm sorry, but $3,000 for a dental or $1,300 for skin testing, I can't see it. I just can't see it.
Yeah, well, it's a real problem we face today.
It is in our profession.
Our
Yes.
going to be gone here pretty soon, and if hopefully enough people will wake up to carry on the torch, because I mean we already have half the pets don't get treated anyway. So many don't receive any care at all, and that's what's sad.
And everybody got a pet during COVID.
Yeah, we did have a big increase in pets during COVID, and now we're facing a time where people had besides getting a pet, they had extra money to nothing else to spend it on. So we had this big increase in care, but now the amount of people bringing their pets in has dropped. And like you said, costs have gone up. All the veterinary labs have greatly increased their prices. So it's really tough to balance, to provide adequate care, and at the same time, make sure the pets are treated and you can get compensated fairly. And like you said, these corporate driven price structures are definitely affecting negatively the profession overall.
Sad. Well, Janet, you got any other questions? You're going to order some beaver. Wait, give me again, Jeff. Beaver
Island. BeaverIslandHemp.com. I'll send you a link afterwards.
Okay, good. Because we'll have a link to Dr. Power's site. So
And if you have questions about CBD or THC, be sure and ask. We can get those questions to Dr. Powers and get an answer for you.
That's right, because
Yeah, I'm not the
I
one to
can't do it.
ask.
I refer at my CBD, Dr. Powers. It's a straight train ride right there.
This has been super interesting. Thank you.
I call Dr. Jeremy. So
I do have one funny story to tell you before we close. When I met Dr. Powers at, we were on a committee together for the American Veterinary Medical Association in Chicago. And it's like a round oblong table of like 20 people that don't know each other. And we were the only two normal vets there. Okay. We're the only two working vets. There were lawyers there. There was the girl from the FDA. There was DEA. I mean, it was fascinating. I met a lot of interesting people. So it was always on a Thursday. Thursdays for me are very busy, and they are for Dr. Powers. So, they'd be talking about something, and I'd be answering emails from my office, making refills and stuff. So then I hear they're looking for another member on this committee. And I'm answering an email, and I hear this voice go, "What about Dr. Jerome?" And I look up, and it's Dr. Powers, who I barely knew at the time, at the other side of that table. And that voice, and I'm like, oh my God, what now? So that's how we met. And we've been friends ever since.
Yeah, well, I looked around the room, and like she said, there was no one else that had any practical knowledge there.
Oh, we were the only one in the trenches. Everybody else hadn't dealt with animals. And then they'd come up with some thing they were going to try to make into a policy. And Jeff and I were like, no, listen, we're working every day with clients and pets. This is not how it is. And I have to say, we weren't really listened to a lot.
See, and that's marketing 101. You do a focus group.
Did what they wanted to anyway.
Yeah.
Or stop the good work.
Yeah. All right. Well, I guess we're winding it up. Again, thank you so much, Dr. Powers. I mean, I learned a lot. Janet, I hope you did as our technical pet owner here.
And one more thing, Dr. Powers, go Buckeyes.
Yeah, well, better than the Spartans. They're not doing much right now.
I know, but my second love is the Detroit Lions,
Yeah, I was rooting for them.
They'll do it next year, though.
I was rooting for them.
We'll see. Keep our hopes up. Cleveland, the coaches, he got Coach of the Year, right?
He's our hot coach.
He got hot Coach of the Year, Dr. Powers.
Yeah, but hot assistant quarterback got
hot
comeback
assistant quarterback of the year. Yeah.
Dr. Powers, can't thank you enough. Janet, have a good rest of your day. Jeff, I hope no more marijuana toxins come in today for you.
Yeah.
Hopefully not.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and/or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.